This idyllic cottage community is just 2 hours east of Winnipeg in northwestern Ontario. But it's still hard to lure family doctors to work here.
In rural areas, the family doctor, ER doctor, anesthetist, hospitalist, they're all the same people. So we are short across the board and just trying so hard to keep the services available for our patients, our families, our community members.
Dr. Sarah Giles worries plans to extend family medicine residency from 2 to 3 years will mean doctor shortages will get even worse in communities like this.
It's just going to prolong the process and we will have fewer graduates. It's a foreseeable disaster and it's an unnecessary disaster.
But the College of Family Physicians of Canada says patient needs are getting more complex, and 2 years of training isn't enough to cover everything family physicians will need to know in the community. Things like elder care, mental health and addictions, and Indigenous health.
It's really not in any way an indictment of current training. It's just more we need to keep up with the times and we need to make sure that our training kind of evolves.
The advocacy group representing 10,000 Canadian medical residents disagrees.
In the absence of a very well-defined, well-rationalized, evidence-based reason to extend training, that we cannot support any extension of training.
I do think that if the residency had been 3 years, I think it would have potentially impacted my decision to go into family medicine.
Dr. Zeke Blumenkrantz has been working as a family doctor since July.
In fairness, I don't think anything can really prepare you for independent practice. Doesn't matter how many years of residency or fellowships you do. I feel like after 2 years, I am quite well prepared to work as an independent family physician. You know, in the first 6 months of independent practice, you will likely learn more than you have in your entire residency.
Canada does have some of the shortest training for family doctors in the world, but some groups, like the College of Physicians and Surgeons of Ontario, say the training should actually be shorter, focusing on core skills and not longer. Karen Pauls, CBC News, Kenora, Ontario.